Peoria paramedics are using new technology on emergency responses, and that's great news for heart patients.
All Peoria Fire Department engines are ALS, so that means they have 2 paramedics and 2 BLS EMTs. So every engine has this. Our brush truck has this monitor, and any units patrolling up at the lake will have this cardiac monitor.
Our hope is that when paramedics show up to the scene of a patient who's having chest pain, that they do a 12-lead EKG, and that they then transmit that EKG to us via fax. What that allows us to do is view the EKG before the patient arrives.
We can send everything that we just learned about this patient in terms of their electrical output and what's going on with their heart. We can send that, as I said, to the emergency department, who can notify the cath lab so that there's less delay, because time is muscle. When we get through the doors of the emergency room, they know what's going on. We'll hit start acquire, and we'll input the age of the patient, 56-year-old female. We ask the patient to hold really still for just a few moments. It takes about 10 seconds to analyze. Once it analyzes, it's going to have a printout, and it's also going to show on our screen the interpretive statement and what it believes is going on with the patient.
In the past, paramedics would obtain EKGs, and there would be a lot of artifact, meaning a lot of waving on the line, so you really couldn't get often an accurate picture of what was going on, especially in the back of a moving ambulance. Now with the new technology, they're much cleaner pictures, and they now have the ability to also send those images to us, or the EKG to us.
The doctor and the paramedic agree. Anytime you have a chest pain, that's reason enough to call 911.